Good afternoon. Welcome to In the Trenches. I'm going to discuss a patient I saw this morning. The patient's an 86-year-old man. He's got a history of coronary disease, hypertension, mild chronic kidney disease, 3A, increased lipids, borderline diabetes, complained of some increased swelling in his right lower extremity. I looked at it, and he had prominent veins that were superficial, especially in the greater saphenous vein. Now, what do you do here? What to do? I was concerned maybe I had a DVT. And I got a venous ultrasound stat, and it was negative. But I needed to know something. Superficial vein thrombosis, also known as Phlebitis. Normally, these people are not anticoagulated, but there's a bugaboo. The greater saphenous vein travels medially, and if it's within 5 centimeters, if there's a clot there, and if it's within 5 centimeters of the saphenofemoral junction, it could go right into the deep system, high up, and ergo it's not that benign. So if there's a clot there, normally you treat them with warm soaks and non-steroidals, but there's a clot high up. There's some data indicating these people should be treated for 45 days. First study, close to 10 years old, was called Callisto, which used sub-Q fondoparinox, which is a parenteral anti-10A inhibitor. More recently, there's the Surprise trial, which used 10 milligrams of rivaroxaban and used them both for 45 days. Now, what I did, I called the radiologist who interpreted the test and wanted to know how far up they went to look at the saphenous vein. He said high up around the saphenofemoral junction, there was no clot. So this patient doesn't need to be treated. The purpose of this is to realize that sometimes these patients need to be treated. He had prominent saphenous vein. I couldn't feel any thrombosis, and they did not go all the way down the leg to scan for that. I'm going to see him back in 2 weeks, and if there's any concern, I will re-image him. But if it's within 5 centimeters of the saphenofemoral junction, they should be treated with 45 days lower dose of an anticoagulant. That's it.